Where am I? I think I'm supposed to be watching the show called Jen Cow, the Science Gal. I don't know where I am. Where am I supposed to be?
Excuse me, miss, but that is not your seat. Make way! Hello, I am Jen, your pal, the Science Gal, and this is my show. And this is my assistant, Frank. Say hello, Frank.
Hello.
Hello. Okay, so today we will be learning about heart transplant surgery. Yay! Yay! Jen, Jen, Jen. Jen, 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 pal, the Science Gal. So, where do we start off?
What is a heart transplant?
A heart transplant is a surgery where the heart of a weakened patient is removed and replaced by a healthy, functioning heart. A heart transplant is needed when the heart fails to maintain its function. Clogging of arteries or heart vessels or valves are severely damaged. A valve transplant is a surgery where a damaged valve is replaced by a human, artificial, or animal valves. This transplant can help the heart from pumping blood in and out the other parts of the body. Both of these surgeries required research from the past and are still in development for the future. This is one of the factors of leading to heart disease: poor diets. The next factor leading to a heart attack is smoking. Dun dun dun. Stress is our third point. Huh? Are you okay?
Honey, you should go do some exercise. You've been sleeping all day.
No. Lack of exercise.
So Frank, are there any risks of doing a heart surgery?
Well, Crystal, that is a very good question. Most of the risks of a heart transplant surgery are most common with organ rejection and infection. Most infections are from side effects of the immunosuppressive drugs. Your white blood cells are unable to fight bacteria and viruses, and because because the drugs are too busy ignoring your heart, that they also ignore other bacteria. So small infections can do big harm, but we try and treat those infections with antibodies. Also, other risks are bleeding, irregular heartbeats, reduced cardiac output, pressure on heart by fluid in the space around the heart, which is called the pericardial tamponade. There is increase of blood in the there's maybe too much blood in the circulatory system or too little blood in the circulatory system. Half of the patients develop coronary artery disease 1 to 5 years after the surgery. There are also chest pains called angina, which is a sign of chronic rejection, and or coronary allogravascular disease.
Oh no! I wonder if there's enough heart for people who need heart transplant surgery.
Well, there is an organ waiting list. In 2000, 2,196 transplants were performed out of 30,000 according to ISHILT database. There is a computer program that ranks patients according to blood type, size of heart, and how urgently they need it. First, the local list is checked when there is a new available heart and compared with the qualities of the heart. Then the regional list is checked, and finally the national list. The patient's transplant team or specialist will then decide if the chosen heart is suitable for the patient. This is also determined by the United Network for Organ Sharing, UNOS. An alternative, while patients are waiting for their heart, is to use a ventricular assist device or myocardial resection for ventricular restoration.
Try this at home, if you dare. Fear factor.
We will now perform the transplant surgery. A healthy heart is obtained from the donor, and the healthy heart is put in a special solution to preserve it. The patient's blood is circulated through a heart-lung bypass machine, which helps keep the blood oxygen-rich. The patient is put into a deep sleep with general anesthesia, and the surgery now officially begins. A cut is made through the breastbone to access the heart. The diseased heart is removed by cutting away the valves of the heart and away the superior vena cava. The donor heart is then switched in place by sewing the heart openings back with the regular valves. The patient is then sewed up and treated with antibiotic gel, and the heart is now in position. The heart-lung machine is then disconnected and blood will flow through the transplanted heart. We will then monitor the patient in the intensive care unit for 24 to 72 hours, awaiting any problems like rejection. Dun da da! Okay guys, after the patient is closed up, we have to monitor closely in the intensive care unit for 24 to 72 hours. They need to receive extra oxygen for 4 to 24 hours. We need to pay attention to the renal, liver, brain, and pulmonary functions. Patients must take immunosuppressive drugs before to prevent immune rejection of heart. The rejection most likely happens within the first few months, and they have to take the immunosuppressive drugs for the rest of their lives. For 6 to 8 weeks after the surgery, the patients must come to us twice a week to check for any complications. In addition to regular tests, we have to do lab tests for infection, chest x-ray for signs of lung infection, electrocardiogram to check heart function, echocardiogram to check function of ventricles in the heart, blood tests to check liver or kidney function, complete blood counts to check for the number of blood cells, taking a small tissue sample from heart donor to check for any signs of rejection. We must perform an endomyocardial biopsy, removal of small sample of heart muscle to check for any signs of rejection. This happens weekly for the first 4 to 8 weeks. This is also called a cardiac catheterization procedure.
Are we done now? Huh? So fast.
Move! Well, that's the end of our show. Thanks for watching Jen Pal the Science Gal. See you next time. Jen!